Welcome to the second annual National Conscience Month, Physicians Panel Discussion. My name is Valerie Chiquitas. I'm a faculty member of the American Meditation Institute in Averill Park, New York. Today's webinar concerns the ways physicians benefit from yoga science and its practices, and specifically how they understand and utilize the conscience in their medical practices and in their everyday lives. Before I introduce them, I'd like to take a moment to make you aware that January is National Conscience Month. It is a time to remind and encourage individuals across the nation to practice using their conscience in all their decisions. We all know of our conscience as that voice we hear in our minds that says, do that, or don't do that. However, our conscience is much more than that. Our mind is our most valuable asset. We use our mind to make thousands of choices every day. Physicians' decisions affect themselves and patients. The pressures of being a doctor creates a serious problem of physician burnout. It has been a growing problem, and the COVID-19 pandemic makes it even worse. Anxiety, depression, headaches, sleep disturbances, hypertension, cardiac events, alcoholism, or substance abuse are symptoms of burnout. Those affected often suffer from cynicism, despair, a loss of meaning and joy in their personal accomplishments and/or work. Physicians and frontline care workers now face putting their families and colleagues at risk for exposure to the virus. They are working extended shift hours and confronting a staggering death toll. One measure of the severity of the burnout is that in the US, the suicide completion rate among doctors is 44% higher than the general population, roughly 400 per year. The American Meditation Institute is devoted to providing comprehensive training in AMI meditation and yoga science as mind-body medicine. AMI presents practical and effective tools that enable physicians to achieve personal and professional fulfillment and provide more compassionate and insightful care to patients. Today, we're proud to present physicians, all practitioners of AMI meditation, who will share how learning to understand and rely on their consciences through yoga science and AMI meditation has enhanced their lives as physicians and individuals and helps them help their patients. At this point, I would like to share our physicians. We have Kristen Kelber, Dr. Larry Lorenz Iorani, I'll get that. Dr. Janine Pardo, and Dr. Anita Burke-Stotts. We also have Renee Rodriguez-Goodmote, who had a little difficulty getting back into the webinar. We will try and work on that technical issue in a moment. But at this time, what I would like to do is ask each of our guest panelists to take a couple of minutes and introduce themselves. Give us a little bit of a background about your specialty, how long you've been in practice, and a couple of other things that you might think the audience would be interested in. And if you don't mind, I'd like to start with Kristen, and then whoever feels like jumping in next, please do so.
Thank you, Valerie. My name is Dr. Kristen Kelber. I'm an internist and pediatrician practicing in Cleveland, Ohio at a large academic medical center called University Hospitals. I practice at Connor Integrative Health Network. I am also certified in lifestyle medicine, and the majority of my practice is working with patients who suffer from illness where they've been to many other different specialists and haven't received benefit yet, or they're seeking other ways to improve their health and the symptoms that they're experiencing. So I see a lot of people with chronic pain, stomach issues, headaches, depression, many of the chronic medical problems that we hear a lot about, heart disease, diabetes. And I've been practicing about 20 years, trying to remember all the things I need to answer. I have been working with AMI since 2015, and I came to AMI because I was seeking help with my own medical practice, meaning at the time I was feeling a lot of burnout. We use that word liberally today, but I was feeling like very unhappy with my medical practice. And one of the things I want people to know is I feel like working through the American Meditation Institute has really transformed my medical practice to one where I just am very happy most of the time. And I never thought that was possible. So I'm very grateful to AMI for all of the help that I've received by just doing the practice. So thank you, Valerie. I don't know who to pass the microphone to.
Who's willing to go next?
I'll take the microphone. Hi, Valerie. Hi, everybody. My name is Larry Iannarone. I'm a general surgeon. I've been in practice for almost 40 years. I do plain old general surgery. I'm also recuperating from COVID, which I've had for the last 2 weeks. I wish everyone who unfortunately gets this fares as well as I did. My wife had it as well. It's a fairly devastating illness. I was unable to even get from my bedroom to my living room without having to stop because I was so short of breath. Luckily, I got antibodies, and with the antibody infusion, we're both starting to recuperate. So I urge everyone to wear masks, social distance, wash your hands. But even with that, there's no guarantee. So I hope everyone fares well. With that in mind, I've been practicing for 40 years. I probably contracted this from one of my patients. As physicians, we're in close contact with all of our patients. And so we're really on the front lines. And that adds to the burnout that we see. There's a lot of fear as to will we get this illness, et cetera, et cetera. I'm a general surgeon, so I love to cut. My favorite conference, as everybody knew because they know my story, is that I like to go to Vegas to the trauma conference every year. Why? Because it's Vegas, and two, because it's trauma. And my wife finally dragged me kicking and screaming 1 year up to the Berkshires, where I met Leonard for the first time. And after 3 days, I was hooked. I was so hooked that when we were doing meditation one morning, I felt my blood pressure drop. I felt my pulse drop. And in fact, I almost passed out. That's really when I was hooked. And I said, there's something to this, not only psychologically, but physiologically. And I took this back to my patients. And I actually came back to AMI multiple times. And Leonard and I have become friends. And I'm thankful for that. And I wanted to see what I could do for my patients as a general surgeon. My first experience with AMI. I was the only general surgeon in a group of about 45 to 50 people, and I felt like a fish out of water. And of course, everybody made fun of me, and I was the brunt of some jokes, which was fun. But I said, as a general surgeon, what can I do? And I realized that a lot of this is mind over matter. And I wanted to see, especially with this opioid epidemic, if I could benefit my patients. And so I started a study, which is now complete. I am tallying up the results. It got waylaid a little bit because of COVID, because we shut down our elective cases. So that delayed it a little bit. So I started looking at hernia patients, and hernias are one of the most important things that we do, most frequent surgeries. And throughout the years, hernia has been very painful and have had people out of the workforce for quite some time. And so I use what I call 1-point focus, 1-point attention, and I have my patients focus on that. And I've been able to use that in the postoperative time frame and actually have my patients almost 70 to 80% use absolutely no narcotics whatsoever
Larry?
After their hernia repairs.
Larry?
Yes.
I'm sorry to interrupt you, and you will have an opportunity absolutely to go further into your study, which I know everyone is interested in hearing more about.
Well, that's all I wanted to say. I've been using that in my personal practice.
Thank you very much. Appreciate that. I'd like to ask Dr. Renee Rodriguez-Goodmoat to go next. Renee was the person that we had a little trouble getting back into the, that's what happens when you get here very early. Renee was our first person online. Would you please say a little bit about yourself?
Wonderful. Welcome everyone, and thank you for sharing our time together. I just wanted to introduce myself. I am a family physician. I've been a family physician for just over 20 years, and it's been a wonderful vocation, as I call it. And I tell students all the time that medicine is so demanding that it really is a vocational art, and we never finish learning, and it's a wonderful field that we can continue to develop over time. And meditation and the tools that are offered through AMI are really medicinal, but they're also a really great opportunity to practice self-care. But I also tell people, it's made me a better diagnostician. So it's made me a better physician in the office, because there's just so many aspects of that allow you to be able to tune in and become observant. So we're observant of ourselves in our meditation practice, but it also allows us to be quiet and be with the patient, to be able to really observe and listen and hear. I went to my first AMI conference in 2014, and I always tell this story. I tell this to my patients, that when I first started meditating with the guided meditation during the conference, I had the Disney Mickey Mouse cartoon reel picture in my head, and those were like my thoughts during meditation. And I finished and I said, wow, I've never realized that, but it was also a really good picture for me. And I share that with patients because it's important for them to understand that we have a shared experience. Many of us have had something similar to that. I find it difficult to separate certainly personal practice and then not share that with my patients. I'm a family physician, so it's very easy to do that. So I've been incorporating that into my practice. I have done that. I'm an employed physician that's employed for a hospital system, and I do that in the form of group visits and then one-on-one visits in all aspects, the Ayurvedic component with nutrition, meditation, and I have a patient population that is relatively low income, high Medicaid population. So it really, you don't have to be in private practice to be able to make it applicable. Thank you.
Thank you very much, Renee. Janine, would you like to go next?
Sure. So I'm Janine Pardo. I practice at a concierge medicine practice outside the Boston area, where we combine strong primary care for adults with a very holistic, very lifestyle medicine forward approach to care. I've been in practice in general in primary care in some shape, form, or fashion for the last 15 years. I went to my first AMI conference, also 2015. And really, I've always been interested in integrative care. I studied medical anthropology in college, and always had a strong sort of sense that that my role in primary care and my style of practice should be incorporating all of these elements of our lifestyle, mind, and body, and that there was really inextricable from the more sort of medication forward traditional care model, that we really needed to merge those things together, and that would be what was best for patients, because the lifestyle that they live and the choices they're making every day really mattered. And so it was sort of in that spirit that I went to AMI, thinking I would at the very least learn meditation practices that I could teach my patients and work with them on as part of the stress management work that I was naturally doing, and really just found that it was so much more and really profoundly affected just me personally and my philosophy on life, frankly. And then, bringing that into sort of the work I do in the world. And now I would say I regularly incorporate the teachings I've learned through AMI, both in my daily personal life and in my practice, and the work I do with patients, and also doing a lot of education in terms of meditation's effects on the brain and on our genetics, and how it can also affect other facets like sleep and food choice and so on. So that's kind of the nature of my work now. And yes, grateful to be here and to have the opportunity to participate with this very special community.
Thank you very much, Janine. And now, Anita, would you go?
Sure. Good morning, everybody. I am also an internist, trained as an internist, and have been practicing many, many years. I think I'm kind of a contemporary of Dr. Larry, and I would also just like to wish Dr. Larry and his wife a continued good recovery. Wow. I had been interested in what I think most Americans would think of as yoga for many, many years, going back to my early 20s, and was always in some sort of yoga class. And that's actually how I first learned about AMI, through the pamphlets that used to be left in the yoga schools. And I had also gone to Kripalu, which I think most people who are on the call probably have heard of, and got my first dose of what, there's quite a bit more to yoga. So I got this wonderful introduction to yoga science at a course that I took at Kripalu in Massachusetts by a wonderful teacher named Joseph LePage. And that just really struck me as true and real and useful. And I was very intrigued. And anyway, so I found my way to AMI initially through the movies that used to be offered. This is a long time ago, back in the early 2000s. And the first time that I took the foundation course was before AMI offered CME courses. And I really, I was in a part of my life where I had been through a lot of loss and sorrow and stress, and probably was a little burned out professionally, but had a lot going on personally that was difficult. I was just trying to do my best to carry on. And I think I had kind of gotten into a place where I didn't really feel like I would ever have much personal peace or happiness, but that I needed to go forward to take care of my patients. So anyway, I took the course thinking that I would learn some things to offer to my patients. And I was immediately challenged, kind of, what Janine just said, to apply the teachings to myself, to my personal growth, and found that over the years, it's really the AMI teachings and meditation have become my guiding star. About 12 years or so ago, I switched my focus from straight internal medicine to something called functional medicine, which is a system that really looks for underlying causes. It's very science-based, but looks for more like underlying causes of medical issues, and also recognizes the mind, body, spirit connection. So it is just a particular type of integrative medicine with a particular type of training. And I found that my AMI training works beautifully with the functional medicine that I now practice. So I have the luxury of spending more time with my patients and of also stressing lifestyle while I'm also working on the science part of trying to help my patients. And kind of like Kristen said, many of my patients come to me after they've been to many other practitioners and have had a lot of frustration. So it's very challenging work. But usually there's, quite a bit of benefit that can happen if a patient can at least be opened up to the idea that the mind-body connection is so important. And so I do share everything that I've learned as much as I possibly can, and definitely talk about stress, and have now a really useful platform to try to share with patients and continue to use it on a daily basis in my own life. So thank you. Looking forward to the rest of the webinar. And thank you to Valerie for organizing this. I just want to say, excellent job. Thank you.
Thank you very much, Anita. The presentations and your introductions really lead into the additional focus of the webinar, and that is really giving you all an opportunity to share further and deeper in the things that you've already just raised and what you've just said. So we have questions, and even though there are a series of questions, I look forward to a conversational approach to the rest of the webinar. But I also want to mention to our audience members that they should feel free to write any questions that they may have for the panelists. If you have something specific for one physician, please indicate that, or a general question for the entire panel. There is the question and answer component space on the bottom of your screen, so please feel free to put your questions there, and we'll try to get to as many as we can before the end of the webinar. I'd also like to just mention that our teacher, Leonard Perlmutter, Ram Lev, as many of us know him, is in the audience, and it is available to answer some questions if any of our physicians want to ask a question or a point of clarification. And we all know that if he has a point to make, he will be letting us know as well. So I just wanted to give everybody a heads up that that is a possibility. So fortunately, you all kind of answered the very first question that I had, which was, how did you all get to yoga science? Pretty much in some fashion, found your way to yoga science based on your own impulses and what you were looking for, which I think is pretty evident for many of us in various ways. But I'd also like to ask whether or not and how yoga science impacted your own health. I think, Anita, you kind of referenced that in your personal life being rather difficult when you were first exploring or came upon yoga science. So if you want to say anything further, or someone else wants to talk about whether and how yoga science has impacted your own personal lives, health in your lives.
Well, I just find that I'm still unmuted, so I guess that means I should say more. So, yeah, at the time that I became a student at American Meditation Institute, I had very high stress level. You know, I think, show me the doctor who doesn't have a high stress level at some point. And I was doing primary care. Again, you know, I'd had a lot of loss, you know, tragedies and difficult things in my own personal life. You know, I definitely had physical symptoms related to stress and difficulty with sleep, and you know, a lot of the same symptoms that we see in our patients all the time with stress. So, and I had really just kind of entered a part of my life where I accepted that, well, this is how it is, you know, for me. And I was actually very surprised, challenged and surprised to learn that these techniques were so powerful, and that, you know, really, as soon as I began to meditate more regularly, I started to feel better. And then little by little over the years, with, you know, a lot of loving attention from the teaching and the teacher, I also began to heal some of my own broken parts in my spirit, if this makes any sense, because AMI is really more than just learning meditation. It's an entire philosophy that teaches us who we really are, or, you know, let me put it a different way, encourages us to keep inquiring. Who are we? Are we just our pain? No, we are more than that. So that was really, you know, that's my experience, is that this process of systemic inquiry and challenging oneself has been instrumental for me to have more peace and happiness, and to release a lot of the stress symptoms that I had personally, and also to be able to understand better how to help patients who come to me who have stress and various symptoms that I know are at least related, maybe not completely, but in some way to their stress. So I hope that makes sense. That's, you know, my experience.
Thank you. Anyone else?
I'll say something.
Thank you.
When I began seeking, as I mentioned before, I would say that I was suffering from physician burnout. And what that meant to me is that I went through my daily life with a sort of backdrop of constant anxiety about, was I doing a good enough job with taking care of my patients? How was I being as a mother and a wife? And what I found by listening to Leonard and just doing the practice, they say that in the beginning, I heard that over and over again, just do the practice. I just learned to become more of an observer. And I guess I was able to shift my focus of being a doctor from taking the patient's burdens and putting them on my back and carrying them 24 hours a day, to being able to observe what they were telling me and trying my best to serve them by trying to understand who they were, where they were, and how could I meet them to offer them a small seed that they could begin to work with. And in doing that, I was able, I feel like, to be able to be more present in the moment with each patient. Renee mentioned that earlier, that you can really focus all of your attention on that person. And that carried over into my life after work. It used to be that I would come home and I'd be making dinner and thinking about what happened earlier in the day and not focused on what I was doing with my family. And this practice of one-pointed attention that you learn through meditation, I believe, helped me to be very present in each moment. I mean, I'm not perfect, for sure. There are times where I get thrown off and triggered, but I feel like over the past 5 years, I've learned much better how to really help each individual patient. And that has paid off with feeling less of that anxiety. I don't feel that the anxiety that I had before. And if you really can focus all your attention on what you're supposed to be doing at that moment in time, you become very efficient in your day. So I feel like that has been a benefit too. So I'm able to really focus on the things that I have to do in a day, if that makes any sense.
Yes, it does. It seems that a theme here is the sharing of your practice and what you learn from the practice with teaching points with your patients. And I think that would be particularly interesting for people in the audience to hear what your experience is in that process of teaching your patients about yoga science and or specifically meditation or one-pointed attention. And I know, Renee, you actually have that as part of your practice. You've shared that. Would you talk a little bit about that?
Sure. I'm in primary care, so I'm again a family physician, and recently, the trend, depending on the type of practice that you're in, may be a kind of a referral model. And when I first started with this, I started a chronic pain group that was meditation based. So it was, I did it after my AMI conference. I was really excited about it. And Leonard helped me with the curriculum that I developed. And it was started as 8 weeks. I did it as a trial with patients, and then they loved it. And then I continued it. And when I first started getting some data from that and sharing it, then I would have physicians come up and they would say, well, can I just refer my patients, or where would I refer my patients to? And I kind of took a different tack, and I think it's rather helpful to kind of think of the teaching people how to fish. And so we are teaching ourselves, but it's also, we have the ability to share a relationship with another person and share those teachings. So kind of getting away from almost the referral piece and then doing it over time. I found that the group visits are the most productive way to do teaching on a weekly basis, as opposed to having patients come in once a month, for example. Now I do that as well, but the group visit is really nice for patients to be able to experience a social connection with each other, a shared experience. They can see that others are going through something similar. And then each week we would introduce a different aspect of meditation. The idea that meditation doesn't have to be sitting down in cross-legged on the floor, and kind of dispelling some of those concepts. And it was very similar to what Chris and I share that with patients. And I say, I've experimented with the practice myself. It doesn't mean my experience is going to be yours, but how about you just try? And then we kind of share feedback. I found it very rewarding, both personally for myself. The other thing I wanted to squeeze in there was the idea of releasing your expectations from results. Again, the type of medical climate that we're in, there's report cards and we get grades as to how we're doing. So we're in medical school is very grade oriented, and kind of releasing from the grade idea or the expectation, so that if someone's really struggling where they may not have access to food or finances or things like that, not getting frustrated when their A1C is elevated or the outcomes or the measures aren't being reached because someone's non-compliant. And I've kind of banned that word in my practice. I said, we don't use that word here. And really just, I say to patients, I'm your guide. I'm here to walk with you, and your journey is going to be your journey, and we'll walk it together. And we'll just see where it goes. And so I think that's been very rewarding, at least professionally for me, letting myself let go of the expectation and just be present for that journey with that individual, and then putting in the meditation or the group visits or any of the breath work or the practices as we go along the way. And so if that could be somewhat helpful for anyone listening, I would love to impart that. Thank you very much.
You mentioned about the different practices that you share with your patients. Are there other examples from other physicians who have specific or particular techniques or practices that you use with your patients? Kristen?
I would love to answer, but I think it would be nice to hear what Larry has been doing, maybe, because he's, if you wish.
Absolutely. Larry?
Yeah, my experience is a lot different from everyone else. Again, remember I was the only general surgeon in that group a few years back. And I don't have a lot of time with my patients. But what I have that's a lot different is I inflict pain on patients. I operate, and of course, post-operatively, patients have pain. With the opioid crisis, and it's really very, very, very significant. And hernia surgery in the past 30 to 40 years has been very painful. Men have been out of the workforce for 3, 4, 5, 6, 8 weeks post-operatively. And so this was a way for me to see if what I had learned from AMI could be put to good use with other patients. So again, I only have a few minutes with the patients. And so what I do in about 5 minutes in the pre-op holding area, and I also do it on their visit pre-operatively, is I have them focus on their heart, their diaphragm, and their breathing. And I teach them that although we can do multiple things at once, you can smoke a cigarette, drink a cup of coffee, and do a manual labor. But when you really put everything in focus, you can only think about one thing at a time. If you're thinking about that one thing, everything else falls by the wayside. And so in dealing with postoperative pain, although the pain pathway still goes up the dorsal horn to the spinothalamic area and to the thalamus, et cetera, we actually are able to turn pain off at the cortex like a light switch. And I teach them one-point focus to focus and close their eyes and use the breathing technique that we were taught and focus on their heart beating in their chest, and that this is the most important thing. And I'm able to do this in 5 minutes. It's really, I'm really like flabbergasted. I have people who I never thought would respond to this, and they have, to such an extent that I am really amazed at the decreased use of opioids that I've been able to gain in the postoperative time frame. In fact, about a month ago, I operated on a patient who is a Homeland Security agent. And once I was done with this with her, and she came back into the office, I said, "How did you do?" She said, "That was the most amazing thing." She said, I had no pain whatsoever. She said, I know it was there, but I was able to turn it off. And she said, I'm going to take this back and have a seminar with our agents. I think I can use this in the field. So that was really something special. So I have a very limited experience that I can offer with my patients, but I think it's one that's really phenomenal.
Absolutely. It sounds tremendous. Will you be publishing your study?
Yeah, hopefully. Like I said, I got waylaid a little bit with the COVID crisis, but the study's done. So I'm starting to tally the results, and then it's just a matter of where it gets submitted and who accepts it, et cetera. So hopefully it'll be out within the next several months to a year, hopefully.
Excellent.
Valerie, can I comment on Larry's?
Yes.
I think it's so interesting, of course, like what you're doing. And I would just point out the power, the empowerment, both for the patients and even in your own personal experience as their physician in that context. Because I think that, part of what we're all experiencing on the physician side in sort of that burnout space, but also in the context of just everyone in the world in this pandemic, is this sort of disenfranchisement, this disempowerment, and where you as their doctor, as their surgeon, seen as this very sort of biomedical, person of power, are the one communicating to them about, hey, like, not only do I do this, but this can work, and this can objectively like reduce your pain and your reliance on opioids. And I think it's so empowering for the patient to hear that from you. And also, as we contend with these burnout factors, to feel as a physician like you can do something that's actually that meaningful. I think that's also part of the power of AMI and this kind of teaching. So I just wanted to add those thoughts to what you were saying. I think it's very interesting, very meaningful.
Thanks. When I teach the patients this, I not only tell them that it works for post-op pain, but it works whenever they get into a stressful situation. And I've had people call me back saying their own particular situation that they were in and how it helped them. One anecdote, my wife might like it that I mentioned her in this, but I was able to get her out of atrial fibrillation using this technique also. She went back in it. It was a little bit tricky, but you're able to slow your heart down, and physiologically it works. So not only psychologically, but physiologically it works. And I was able to break her atrial fibrillation. So I tell patients that in any stressful situation, this works. And there's a lot of people that really thank me for doing it. And so it's something really worthwhile.
Yeah, and it does speak to, just like you said, the physiological, is if we think about even the science and our understanding of just the stress response, and that's fight or flight, sympathetic nerve system, just sort of stress trigger and all of the adrenaline and sort of downstream effects of that. Not only are you teaching them, and I think all of us in the way we're practicing with our patients, teaching patients how to basically turn that off, even if it's just temporarily, and engage that counterbalance, that parasympathetic, relaxation system. We'll also know from a lot of the stress research that these little sort of breakthroughs in stress are very meaningful, and sometimes even more meaningful than if they, just have sort of like one longer period of time that separates even longer periods of stress. So in other words, if somebody has like a very stressful, sort of constant level of stress throughout the week, and then spends, 20 minutes meditating on Saturday, that's of course beneficial. But interestingly, if they spend 2 minutes on Monday, or 2 minutes, 3 times a day, Monday through Friday, is actually clinically more impactful on reducing their overall, what we call allostatic load or stress burden, you know, than that former situation. So so it is great, and it's I think a tool that is so strong and so easy to use and communicate in that way. So yeah, very impactful. It's very interesting.
Kristen or Renee or Anita, do you want to add to that?
Sure. One of the things that I do with my patients is I actually demonstrate the 1-minute meditation, similar to what Larry has said. I will, you know, pull my chair up close to them pre-COVID. But we would sit together and I would demonstrate what I meant by a 1-minute meditation. Talk about, you know, that the focus should be in your chest and focusing on the aspect of breathing. And similarly with Larry, I would say that there are, you know, huge benefits that people have been able to get from doing the 1-minute meditation. And I agree with Janine in that when people practice it several times a day, they tend to have even better gains than doing it for longer once a day. And this is helpful for more than just pain things, but for anxiety and for, I guess, headaches is a form of pain, but things like that, and gastrointestinal issues, because so many of these things come from stress. And I think one of the things that has been mentioned, but I'll say it in my own words, is the concept of agency, the idea that you're giving patients an active role in their health and improving their health, meaning that in some of the traditional models, the patient comes to you seeking your advice and you write a prescription of a pill or a surgery. And what I have loved about this more holistic model is that you're giving them ideas that they can take into practice. And the more that they can focus on these ideas, I feel like the more benefit they can get, but it also allows them to have autonomy, which is very powerful. So I think that's what I would share.
Well, I would like to follow up on what Kristen and Larry just shared, which is really fascinating, and just talk a little bit about my experience of actually demonstrating with patients. So I will, in almost all of my patients, I end up discussing what their stress management is. You know, that's one of the things that we inquire about in functional medicine. And so I'll ask people, well, what is your plan now? You know, how are you managing stress? And it always opens up a very interesting conversation. And as I said, I have a little bit more luxury to have longer appointments with patients than I did when I was doing primary care. So that's always great. So that opens up the door, and depending on the person, pre-COVID, I also used to do a demonstration of breathing. You know, we would just do something very simple like diaphragmatic breathing. So, some of my patients who will already have a background in yoga or meditation and know more, and we can, you know, get into things a little bit more deeply. But I found that most people are receptive to the idea of doing some breathing. I do talk to them about the sympathetic and parasympathetic nervous system and how, you know, you can kind of train your nervous system to go from sympathetic to parasympathetic by a daily practice of breathing. And I have found that some of the most powerful ways to connect with patients have been when I've sat with them and just practiced breathing for just a few minutes. I have had patients just have absolute revelations of how, you know, how good that feels, you know, how wonderful it feels, and how it opens up our communication much more deeply when that does happen. It's really quite wonderful and magical. So it's more difficult now because I'm not seeing patients in the office, but it can still happen. And I also used to do some classes. I would invite people into the office and we'd have some little small groups and do group meditations, which, you know, is not happening anymore either. But it's a very powerful way to connect also with patients and to open up I think their ability to share more. If you show them that, yes, I really want to hear about everything in your life, including your stress, I think that that's been very powerful for my patients for a number of reasons.
Thank you. A question about your work-life balance, which always seems to be an important discussion, and how your practice with AMI meditation and yoga science has impacted your ability to balance those two in a way that you can share with other people. Anyone want to comment on how yoga science has impacted your work-life balance? Renee?
I can start. Okay, sure. I have a variety of roles that I've taken in my career, and I think many of us together have been presented with a variety of different hats that we would wear. I've served as our hospital's medical staff president and worked on committees like medical executive committee, so more governance and administrative things. I'm a medical director for our practice and then have a clinical practice and a variety of other things. And then we look and we say, well, geez, how many roles can we take on? And then we have to do notes for all of the patients that we saw for that day. And this was after speaking with Leonard, but it was a bit of an aha moment where I kind of look at it, it's one continued experience. When I was putting the separation between work is work and it needs to be completed during these hours, and then home is home and it needs to look like I'm only doing these things at home. That really defined line for me was very challenging. And then when I really looked at my life and my life choices as one continuum, so the work is as it presents itself to me in this moment. I walk in the door at home, and what's presenting in this present moment is my child in front of me, and that's the work I attend to. And I think that helped me be able to just really, really practice presence. It also, through more of a contemplative practice, kind of assessing and checking in with myself, will get presented with participating in a variety of things. Or I'll check in with myself and I'll say, is this really more of an ego thing? Am I participating in a certain professional activity because it's going to help my career? Do I want it to go in this direction? Kind of checking in. And I've shifted it to be really more a question I pose to myself: how can I do the most good? And then that kind of just guided my decisions that way. So that I use as my litmus test to say, I'm going to participate in this activity or this professional activity, or I'm going to do this with my kids because it's allowing me to do the best good. So I think I've also done physician burnout in our hospital, and I've heard a lot of feedback from my fellow colleagues as to the time commitment. And I'll give you an example. We said we'd love to be able to do meditation, and we can make it recorded, and how would you what format would you like this in? And then the emails came back, it needs to be between 12 o'clock and 1 o'clock, it needs to be at lunch hour, it needs to be during the day at work, I'm not going to do it after work. And so it was really a kind of a window into really that prior thinking that may help keep burnout perpetuating, because the rigidity of having to box activities in during certain hours that then would perhaps prevent us from becoming the most whole person we can in our choices. So it's been a work in progress. We're continuing to always work on ourselves, But self-care is really, really important, both for ourselves and our patients. So our wellness and our care of ourselves is paramount, no matter what hour of the day we do it.
Excellent. Thank you. Anyone else? I think the point of taking the barriers down in terms of our lives and not separating them out into components that we have to ration what we put into each component really begins to create that sense of an ability to focus, because you're not thinking in terms of, uh-oh, it's, you know, soon to be 1 o'clock and I have to do this. So you're always up against some sort of barrier versus being in the moment and being focused there. And certainly from the yogic perspective, we talk about that as fields of action. Everything is a field of action. It's what we're always engaged. And if you're doing your best at that moment, then that's what you're focused on. Kristen or Larry, anyone else? Kristen, go ahead. Go ahead.
I agree with some of what Renee was saying. I find, you know, this one-pointed attention helps you to be present in the moment, and helps you with work-life balance. Like what do I need to do right now? Really helps both with your stress around all the other things that happen. If you can really be focused on helping your child or helping your patient, some of that anxiety around what work-life balance is can go away. But also I think one of the things that helped me with work-life balance was to begin, and we've already mentioned this a bit, but I feel like it can't be overstated, the concept of asking yourself regularly, who am I? And that question leads to, how am I to be of service in every moment? And what can I do? What is, as we talk in yoga science, we talk about Shreya and Preya. For those in the audience that don't know what I'm talking about, Shreya is the act that leads you to your highest and greatest good in the long run. It may not be the easiest thing to do, but trying to determine what is the Shreya, what is the right thing that I should be doing in that moment, has really helped balance out my work-life balance and helped me to make career choices that have led to what I consider to be a very enjoyable job that I currently have. I would call it an avocation, in that I do get to do the service that I think I'm meant to do, which is very powerful and allows me, again, to be of service in the way that I'm able to be of service. I'm not a surgeon like Larry. That would have been not a good pathway for me. So I feel like I'm in the right place doing what I need to be doing. And I'm so grateful to people like Larry who are, I feel like he's in the right place too, being a surgeon. He's meant to be a surgeon. So I feel like when you ask yourself over and over again, who am I? And you start serving that Shreya, that what is the next task that I need to focus my attention on and do, work-life balance becomes much more balanced because you're doing the things that you're meant to be doing.
Thank you.
If I can add something, as a surgeon, I come from it from a different aspect, I think, than everybody else. Everybody has stress. Surgically, I wake up in the morning and I'm stressed. And I'm stressed all day until I go to bed. And then when I go to bed, I'm waiting for the phone call to ring. So I'm stressed when I go to bed. So surgeons tend to have to learn how to eat when we can, sleep when we can, et cetera, et cetera, et cetera. And I find that if I use my 1-point focus at various times during the day. When I'm stressed, I find that I can close my eyes and just zone out for 20 seconds or so and focus on my mantra, and everything else falls away. Just for that 20-second time frame, it refreshes my brain and my energy so that I can again focus on what I really need to focus on. So I take these little pinpoint moments in time, 20 seconds or so, and I find that that allows me to refresh myself enough so that I don't burn out.
Thank you. Anyone else?
I'd actually like to follow up on that. I wanted to make a really similar point, which is that we've been talking about stress and burnout, and I just wanted to talk a little bit about how joyful a meditation practice and yoga science is also, and how I think Larry just said it beautifully. Whenever I'm tempted not to meditate on any given day, but then I, sit down and do my meditation, I always think, no, really, why was I not doing my meditation? Because it is a very, special self-care time. We can't really be of service to people as deeply as we're capable of doing if we're not taking care of ourselves. And that doesn't apply to only physicians. I think that applies to everyone. So my experience, and I think I may be paraphrasing here, but one of the things that we say in class, in our yoga science classes, is that meditators are pleasure seekers. And so I just wanted to just say a few words for anybody out there who really hasn't tried meditation, that yes, it's good for stress, it's good for burnout, it's good to help us figure out who we really are. But it can be a deeply restful, like a special kind of rest, a special kind of joy when we're doing a meditation practice and feeling that deep rest, that change in our nervous system. So I just wanted to follow up and stress the beauty and joy and happiness of having a meditation practice.
Thank you. Kristen opened the door a little bit by talking about Shreya and Preya. And we're not going to use too much Sanskrit terms. But this is Conscience Month, and really what you are referring to and talking about is using our conscience, which in Sanskrit is the buddhi. It's what we call on to help us decide what should we be doing or what should we not be doing. And yoga science opens the door for a process where you can do that in a way that focus your one pointed attention. And it may be not a way that most people would think of yoga as a way of accessing your conscience, but that is what it is. It is what we are looking at. And when we do have an unobstructed conscience, we can certainly behave in ways that are beneficial to others and to ourselves. In terms of your practice, is that something that you share in particular with patients, the idea of Shreya and Preya, whether you use that as those terms or not, but how might you use, or do you use those strategies and that focus? Renee?
I can go. Yeah, so I had mentioned before that I have a practice that encompasses a lot of marginalized or at-risk individuals. So we have a lot of, we have an integrated model with behavioral health, addiction medicine, and primary care. And there is a significantly high number of people who have experienced trauma. And I wanted to mention the adverse childhood events or the ACEs allows us to be able to kind of have a conversation around trauma and how that impacts our physical experience. So with that in mind, I also introduce the idea of at least two choices. And there's a model with trauma-informed care, meaning the provider will be able to kind of introduce that concept to an individual and say, if someone is not in a safe living environment, or if they are struggling with alcohol, for example, or something like a tobacco or overeating, it could be any type of lifestyle choice, presenting the idea, I don't use the words of Shreya and Preya, but I usually will say, what's the safest? If you're in that moment, just try to think about between at least two, there's always two choices, in which is the safest choice. And when I use the word safety, I'm not meaning safe as in not taking risk, but safe as in your highest and greatest good. What is restorative to you? What is the safest or greatest good in that choice? And I'll say, sometimes it's the harder choice, but it's the safest one. And then I'll say, we're not going to always be making the safest choice every single time, but if we can collect them together over and over and over again, you're going to be making over time more safer or highest and greatest good choices. So those would be the Shreyas, and you're going to be making less of the Preyas. So I present it that way, and it also allows people to restart any moment of the day. Instead of saying, I fell off the bandwagon, or I started drinking, or I started smoking, every moment of the day is an opportunity to just check in and say, what's the safest option that I can in this moment do? So I found it very, very helpful and very relatable, and people can understand it very easily.
I would add, Valerie, I think a way, yes, totally.
Renee, that is such a wonderful way of framing it. And another way that I would say I present it to my patients is also the choice between a reaction and then a pause. So you have the thought, you have the choice presented to you, and I think what the practice teaches us is that you don't have to just react. You don't have to just go with whatever that first impression or first instinct is, and that if you can take this moment to just take a breath, just connect to that inner wisdom, to that buddhi, then you can see more clearly what is the Shreya, what is the Preya. And again, you don't have to use those terms at all, but just the way I would say it to a patient who's not familiar with those terms is just to just take that breath, look within, ask your conscience, ask your conscience, I should say, sorry, run it through, does this align with my inner wisdom? Does this feel in my gut instinct? Does this feel right to me? And you won't always get it right, or you won't, necessarily make the choice that does align in that moment. But the more you practice and the more times you simply take that breath and take that pause, the more likely you are to find that over time your choices more naturally do align with what is the Shreya, or what is the decision that aligns with what your conscience tells you.
Great, thank you. Kristen, did you want to say something?
I guess I agree with what people have said. I use similar ideas with my patients, and I shy away completely from Sanskrit terms. But I also try to translate what I've learned in this class into things that they can understand, just as people have said before. So Janine was speaking about thoughts, and I talked to them about something that Leonard says many times, which is a thought is only a suggestion. And that was so helpful to me in the beginning of my practice, to think about, just because someone has you think about something, it doesn't mean that you have to do it. Which was very helpful to me. And I think it's been found helpful to some of my patients when we talk about things that they're struggling with. And also, I work quite a bit with food. And one of the ways that I talk about Shreya and Preya, or what's the right decision to make for your highest and greatest good, is talking about how food, you may like the taste of something that you're eating, but that food is not loving you, and talking with them about how food is medicine, and that food can either be loving to your body, you know, a moment on your lips, you may enjoy the activity of eating that food, but in the long run, that food is not actually loving you. And that's sort of this idea of finding food that loves your body, even though maybe temporarily, initially, you won't like the taste of the food, but learning about how different food choices can lead to improved health, that has been helpful, I feel like, to talk about. I feel like this is a yogic concept to think about how food is medicine, and food can love your body. So I think that's one more thing that I've taken away from my practice and translated into words that patients can understand.
Thank you. You raise, all of you have raised a couple of interesting points that highlight the fact that your practice leads you to challenge some of the ongoing cultural messages that everybody has to deal with. Multitasking, you know, the reward is you're a multitasker, you should be doing many different things, and that's, you know, what should get rewarded. And we're saying, single focus, and how that is most helpful to you. It's the same thing with the space between the stimulus and the response. We're so bombarded by so much happening that the reality is we tend to just immediately react. So the message often may be a little difficult because people have to bump up against the culture. And is that something that you talk to your patients about, that what you're suggesting for them isn't what everybody else is doing necessarily, unless they're into a yogic practice or some other contemplative practice? Have you engaged in that kind of conversation, and what kind of reaction have you had? Janine, did you?
Sure. Yes, it's funny. I also was actually talking about this with my staff this week, and talking about exactly this point that you're not actually multitasking. You're just rapidly cycling from one thing to the next, and at the compromise of the larger goal. And so yes, I do sort of challenge them and my patients to look within and just remember for a second that nobody else can hear their thoughts. Nobody else can know what's going on inside their minds or their hearts or their souls or their spirit. And no one else is as responsible for themselves as they are. And so, of course, we're all surrounded by these external pressures and cultural pressures. But at the end of the day, it's how much do you love yourself? How willing are you to be that voice of advocacy for your own self? Because nobody else is really going to do it. I mean, you may have friends and colleagues and support and community, and not to take away from that. That's so, that's so important. But that's not the lead. No one else can be more responsible for your own life than you can be. And the choice to be that advocate for yourself in whatever way is most comfortable for you, it may be tiny steps toward that, is still, it will feel better, and to just try that out. And I think that that's some of the ways that I can broach those conversations, whether it's with my patients or staff or others, to challenge them to just start with that inner dialogue, and just see how you feel. Because even if you're bucking the culture, nobody really knows. It's just thoughts in your own mind. And the more time you spend doing that, usually, almost always, I'd say, you realize how much better that actually feels. And it's easy not to go back when you see the difference, that can make.
Great, thank you. We do have a couple of questions from our attendees, and I'd like to make sure we get to several of them. We have a question for the group. Any of the physicians that care for children as well as adults, have you found any point people to help you maintain your yoga practice? For the doctors in the group that care for children as well as adults, have you found any point people to help you maintain your yoga science practice? Shall I read that one more time and try putting the emphasis?
I think I'm not sure the question per se. However, I do take care of children, and I think the point people with respect to the yoga practice or resources, perhaps, what resources we may use in order to be able to help incorporate a yoga practice for children, or at least that's how I'm going to interpret the question. I take care of families, and many times can introduce the concept of thoughts and ideas, or busyness or busy minds, and usually, the classic middle school or I'd say probably from 10 on up, that really starts to become a little bit more active. And we start to have a conversation or opening that up. It kind of is very easy to incorporate into a well visit as you lead into some anticipatory guidance around peer pressure and self-care, and starting to become alert and aware of some of the pressures and expectations that may be encountered when they're in the school setting. So I incorporate it into that conversation. I usually ask if they have had any experience or practice with breathing or tuning in. And you'd be surprised, many times they have had a practice either in school or they're at least somewhat familiar with it. And then there is some research saying, certainly with children who have experienced traumatic events or stressful in the young years, addressing it, recognizing it is also really, really important over the course of the lifespan. So I usually introduce the concept of sometimes what we feel physically can sometimes be a picture of if we're nervous or if we're scared. So I usually will incorporate that during my well visit, some anticipatory guidance. And then if children are really struggling, I work with a school psychologist. We also have a pediatric psychiatric center here where I practice, and they have an outpatient and inpatient program, so I utilize them. So I am fortunate that I do have a variety of community-based providers for pediatrics that would allow an avenue for meditation to be incorporated into their care.
Thank you. We have another sort of question. The question is, sounds like voiced patient stress may be the entry point for discussion to mind, body, spirit connection. Is that what you would agree with? I see a nodding head, Kristen.
I'm going to interpret that question as, how do you introduce the concept of yoga science with patients? And I feel like not every patient, initially at least when I work with patients, it's not always the kind and correct choice to always bring up yoga science in the beginning. Sometimes you have to start with other lifestyle practices. But I think that it's very powerful when you do have a particular patient who is in as much pain as some people can be in. But also, one of the things that I find is identifying that patient that has such a deep driving desire to help themselves, and they've tried many other things. And so it's those patients that I do spend extra time talking about the possibility of developing, some sort of mindfulness practice. It may not always be go to AMI and take a class, but it might be let's start with, let's sit together and have a moment of breathing and learn how to do a 1-minute meditation, a breathing meditation. And oftentimes it's the patients that are in the most emotional and physical pain that are most willing and most able to feel incredible benefit from starting some sort of mindfulness or meditation practice. And I've even had patients where I have a few times encouraged them to consider taking a class at AMI.
Great. Can I add on to what Kristen just said? So one of the things that I think is especially valuable and wonderful about sharing, what we've all learned with our patients is that, in my experience, many of my patients have had, counterproductive discussions about stress with conventional medicine. And I understand how difficult it is when you are in primary care and you're trying to see somebody in 7 minutes. But they've been more dismissed because of their stress, or they've been, their issues are not taken as seriously if somebody has decided that, oh well, they're just sad, or they're just stressed out, or they're only this, that, or the other. Whereas we have the tools to offer compassion to our patients, and not only the compassion to say, well, yes, I want to hear about your stress, your sadness, and so on, but that there are some ways that we can walk through this together, and do some teaching, some explaining about how this actually works scientifically. But I have found that many of my patients are just so grateful and so emotional when they get a different response, that isn't, well, this isn't really happening to you because what's actually happening is you have stress, where, I can accept them where they are and be compassionate and then utilize tools to pull the whole thing together and work with them.
Thank you. One last question, and that is, how do you clear your mind psychologically at the end of the day after seeing morbidly sick patients over the day? Anyone? Janine?
I'll give just a brief answer, because I think while the character and makeup of the patients we all see, it tends to vary so much each day, and some of us I know have what we might think of as just more challenging populations to work with, but it's really the same sort of approach regardless of the patient, which is just to say that it's okay to not be attached to the outcome for those patients. I think like a lot of the burden that we bear, and I know I've struggled with this, and in talking to friends and colleagues at the conferences, especially, I feel like this is something that comes up, and it's so deeply ingrained in us as physicians, and for many of us as lifelong overachievers, that and I think Renee, you made this point earlier, that or Kristen maybe too. It's just it's so outcomes driven. You get the grades, you take the tests, you go to medical school, you're constantly having to perform, and it's so easy to become mentally attached to those outcomes and allow them to define you, or to feel like you like it's something that you own, or to deceive ourselves that we even maybe have control over those things. And I'm not saying we don't have influence, we definitely do, but we just like we are not our thoughts, we are also not our outcomes. And so, at least for me and for the way I've interpreted the AMI teachings, is that my role is not to see that at the end of the day that all of those patients, whether they're morbidly sick or just super challenging in whatever ways that it's not just on me that they get better, that they survive, that they improve, that their numbers look better. My role, my job as their physician, and my role in my life is not to determine that, but to be present for each one, to be of service in those moments, to give them my one-pointed attention and my listening ears and my compassion, to Anita's point, in those interactions. And then at the end of that time with them, to be able to step back and to say, okay, what does happen to them is not just on me. It's not my burden to bear. Not that I don't care. Of course I care, but that I can detach myself and sort of look at it from that more objective perspective. And I think just taking the time to even reflect on that at the end of the day, or as I ask myself, who am I? Like, as Kristen was saying, to take that moment and ask that question and think to myself, who am I? I am not their outcomes. I am the person who is serving that Shreya in the moment, giving my one-pointed attention, and then being able to let go of that outcomes. And that would be what I would offer in response.
Thank you. Thank you very much. We have come to the end of our time, and two things. One, I would like to say thank you very much to the entire panel. I think this has been an exceptionally informative opportunity for everybody. And I want to say thank you on behalf of AMI. And if Leonard is available, if he would like to say a couple of words, you have the floor, if you are there, Leonard.
Leonard is here. It was just exquisite. It was such a wonderful event and a contribution to yourselves, to the teaching, to your personal and professional lives, to your patients. It was beautiful. Each of you has such a rich experience of using the practice and sharing the practice. It's very humbling to observe. And on behalf of our lineage, I just want to thank you from the bottom of my heart. Just beautiful. Thank you. God bless you.
Thank you. Thank you all. Take care. Be safe.